We are here today to expose and challenge the Minnesota Department of Health's continued violation of the Minnesota Genetic Privacy Law. We are also here to call on Governor Pawlenty to require his Commissioner of Health to obey law regarding government storage and use of newborn blood and baby DNA. Despite Governor Pawlenty's veto of the Health Department's DNA warehousing bill last session, we have confirmed that the Minnesota Department of Health is continuing to warehouse baby DNA without parent consent. This is a direct violation to the rights of the parents and the requirements of the law. The genetic privacy law requires informed written consent for the collection, storage, use, and dissemination of genetic information, including baby blood and DNA. This requirement specifically covers government agencies as well as other private entities. Related to the newborn screening program, the Health Department has never complied with this law. They didn't follow it after it was enacted in 2006. They didn't follow it after an administrative law judge ruled in 2007 that the screening program was in violation of the law. And they didn't follow it after the governor vetoed their 2008 attempt to undo the law. Last month, after several months of trying to get concrete answers from the governor's office, I had a face-to-face conversation with the Health Department's chief legal counsel. I asked him if the department is continuing to store newborn blood, and he told me yes. In fact, despite the legal requirements to do so, he told me the department has not yet developed a consent form. And there appears to be no plan to do so. Although I have since asked if the department is continuing to use and disseminate blood without consent, my question has gone virtually unanswered. We are now almost 7 months beyond the governor's veto and more than 2 years beyond the law being enacted. Thus, the Department of Health continues to violate the state's genetic privacy law and the legal rights of parents and children. They continue to defy the rule of law and willfully violate the statutory rights of parents, babies, and families. Approximately 73,000 children are born in Minnesota each year. The blood and DNA is taken at birth by the hospital and sent to the government. This means that the rights of approximately 200 children and families are violated every day. Thus far, the blood and DNA of more than 780,000 children has been warehoused by the Health Department. It is considered state government property. Most parents have no idea. At least 42,210 children have been involuntary subjects of genetic research. Their parents were never asked. This continued violation of state law by the department is an affront to the rule of law and a miscarriage of justice. It is time for, actually, it's beyond time for, the governor to act. We call on Governor Pawlenty to take immediate steps to assure the public that he supports the rule of law and holds his administration accountable to follow the law. Let me suggest that he issue a statement today guaranteeing the Health Department's compliance with the written informed consent requirements of the genetic privacy law. He could decree that no newborn blood be warehoused, used for research, or shared with others without informed written parent consent as required by law. He could order the Health Department to release public documents in compliance with the Government Data Practices Act regarding research. And he could also promise to dismantle the state's DNA warehouse, protecting the genetic privacy rights of more than 780,000 children whose DNA has been claimed by the state government and warehoused without consent.
I was first made aware of this issue concerning the newborn testing while pregnant with our third daughter, Raylyn. At that time, a new law had just been passed that allowed me to opt out of the storage of the blood sample. And so we made our wishes known to the nurse as she was drawing the blood from our newborn baby, and she was completely unaware of what I was talking about. And so luckily I brought along a printout from the website from CCHC and gave it to her. She brought it to the nurse's station and came back and told me that I had raised quite a ruckus over there because none of the nurses in the maternity ward had any knowledge that after the initial tests were done, that the state of Minnesota would continue to hold those blood samples. Many of the nurses were concerned about their own children's genetic information being used and shared without their permission and knowledge also. I believe it's time for someone to hold the Minnesota Department of Health accountable and require them to follow the laws and respect the rights of parents across our state.
I come to you today as a concerned parent-to-be and as a concerned citizen. Specifically, I'm concerned that the privacy rights of my children and the privacy rights of the children of my friends and family are in jeopardy. My wife and I are acutely aware that the storage of newborn DNA is still being done illegally by the Minnesota Department of Health. We thought the governor's veto was supposed to solve this, but we now discovered that the storage continues. In 2 months or less, our babies will be born. I request here today that the Department of Health make sure that I am clearly asked to consent to the storage, use, and sharing of my children's blood and DNA. This is my legal right under the law. I also ask that all hospital staff be fully educated regarding our choices and our right to consent or not to the storage, use, and sharing of our baby's blood and DNA. We do not want to feel misinformed after we've made our decision, and we do not want to experience any long-term negative consequences as a result of being misinformed. We live in a country of laws. At least I expect those laws to be followed by the government, and once informed, by the hospitals who take newborn blood on behalf of the government. Everything I've learned about the department's actions in regards to storing and using the blood and DNA of newborn babies seems not only wrong, but deceptive. It's not only illegal, but it's being done behind the scenes. As a parent, I should be fully informed, and my legal right to protect the genetic privacy of my children should not be withheld.
It's time for the governor to act. It's time for him to let the public understand and let the public know that he wants the health department to follow and expects the health department to follow the law. Bottom line, in the area of newborn genetic testing, the health department appears to essentially be acting as a rogue agency, following the laws they want and ignoring the laws that they don't. They continue to violate the statutory privacy rights of the people, refuse to obey genetic privacy law, make their own rules, engage in research on involuntary subjects, and purposely keep the public in the dark. How much longer will the health department be allowed by the governor's office to act as though it is above and outside the law? Thus, we call on Governor Pawlenty to immediately put a stop to these activities. It is time to ask for consent, dismantle the warehouse, and let the public know what kind of research the health department is conducting today on the children of Minnesota. Thank you very much.